15 years ago, I started up a company that was involved in nursing actually also. We understood that there were some needs that were not being met. Most of the important needs that we have on a day-to-day basis are not covered by our health insurance. So what was happening is we would get phone calls and our nurse would go out for a momentary visit to give an antibiotic to a patient that was recovering from a very complicated surgery. And the patient would say, okay, and what do I do now about bathing? What do I do now about getting up from my bed? How do I feed myself? And the nurse goes, oh, I'm sorry, I'm only here for orders to give you the antibiotic. And I can tell you that I received that phone call hundreds, if not thousands of times from patients, from family members, saying, what do we do now? What's our answer now? We are there to answer that question. What do I do now?
Most successful businesses spring up from identifying a need, and 24/7 nursing care is no exception. Immediately you're taken care of with your skilled needs, but the skilled needs only last for a certain amount of time, and then they go away and the insurance stops paying. We come in and take care of a lot of the custodial needs of our clients: bathing, feeding, meal preparation, light exercise, transportation, running errands, etc. When the skilled care ends, that doesn't mean that the patient's needs end. That's where 24/7 nursing care comes in. 24/7 nursing care, we offer everything from a skilled nurse all the way through a companion and everything in between. We can do everything from high-tech care all the way to companion care, where you're just sitting there with the person and not even putting hands on them, just having conversation with them and keeping them company.
Talking to the client, but also understanding the surroundings, like the type of home they live in. If it's an apartment, are there pets in the home, and things of that nature that are going to be important in terms of the caregiver that we're going to be placing in that home.
Usually when I walk in to see a family, we will get the patient's diagnosis, assess their needs. We usually will come to an agreement on the most economical plan of care for the client. So at 24/7 nursing care, we're always looking not only at the needs of the patient, but also at the economics of the situation as well.
The most important thing is to have a sense of caring. That sounds kind of trite, but in the name, the caregiver, you have to care for the people you're working with. If you don't care, it'll shine through, and both the client will be unhappy and uncomfortable, and it won't be a productive setting for anybody involved. So the core value is that you have to have a level of compassion and concern for the person you're working with. The core value has to be that you understand these people's needs, and that you have compassion for it, that you can empathize with what they're going through. That's very important to the human existence. It's also very important for their health, and build trust with our clients and their families that we're going to provide them with the best care possible and with someone that's going to become a member of their family. And typically that's what occurs with our caregivers, is they become a member of these individuals' families. And that's very important to us. And I think that's what sets us apart at 24/7 Nursing Care, is that we take that concern, we have that understanding, and we make sure that our caregivers have that same understanding.
I'm very excited to announce today that 24/7 Nursing Care is offering franchise opportunities. With 12,000 people turning 65 every single day in this country, I want to share my passion for providing excellent in-home care.